recording is in progress. Welcome everyone to the State Advisory Council meeting on early childhood education and care. This is the meeting that we will be reviewing several things in terms of the subcommittees. Kindly put your name in the chat so that we can make note of that for attendance. Also, want to invite people to be sure to share input and ask questions because we want to hear from you. We do have a very full agenda this meeting, so I am going to pass this on now to Lisa Unrath, PDG Manager for the Pennsylvania Key. Lisa?
My apologies. Hi, good morning, or good afternoon, everybody. Thank you for having me. If we could advance to the next slide, please. Thank you. So just as a refresher, here are the 6 activities that are remaining our focus for this year and will be the same for year 3. Needs assessment, the strategic plan, maximizing parent and family engagement in the B5 system, support of the B5 workforce and dissemination of best practices, support program quality improvement, and then 6 are our sub-grants, which are our startup grants and our rapid response teams. Our next slide, please. So I'm giving you highlights of where we've had the most work since our last meeting. So in activity 2, the PA strategic plan. The Institute for State Regional Affairs, Penn State, known as ISRA, is gathering insights from our expert consultation, community engagement, document reviews, and diverse stakeholder input. It will outline OCDEL's priorities, focusing on clear goals, measurable objectives, and performance indicators. ISRA will support the planning process, coordinate the stakeholder engagement, conduct data analysis, incorporate findings into the final plan. Core activities include statewide surveys, community roundtables, expert panels, focus groups, and analysis to align with OCDEL's vision and state goals.
You know, she's got the academic skills.
I'm sorry, is that for me?
No, Lisa, you can go ahead.
Okay, my apologies. All of this that work is just starting since the beginning of November. So you will see a lot more work and contact coming out of the strategic plan over the next quarter and then into 6 months. If we could go to the next screen, please. Thank you. Activity 3, maximizing family engagement in the B5 system. These are highlights of work that is ongoing and moving forward. Translation of existing resources developed for the families, our marketing campaign, JPL developing the campaign and videos also as it relates to doing the child find for childcare. New family engagement, child development materials being translated into Spanish, IECMH, resource library translation, promotion, and marketing. And on this link, if you click, you will see all of that has already occurred. Then we have early intervention with family supports and the homelessness toolkit. The next slide. Supports for the B5 workforce. I will let you just read through these quickly on your own. These are the highlights of the work in the last 3 months, and that is ongoing. Activity 5, support program quality improvement. We're expanding the mental health consultation with school age. We've hired 3 consultants. We have the pilot ruler that rolled out, reducing the burden by streamlining data collection and monitoring efforts, targeting collaboration opportunities for family and children experiencing homelessness, the ASQCE2 training tools, and then we have our Hope PHL training
Am I an
session.
unknown user?
If we could move to the next slide. And subgrants. I'm going to speak to the RRT here. Please note that someone else will be talking about the startup grants. So it's not that I'm not aware of that. We just have someone else who's speaking on that. This year, we have moved into full implementation, meaning that ELRC 7 is actively in the planning phase. So they have joined the other 17, the other grantees from year 1. We are supporting the consultants, including Head Start and Pre-K counts and the professionals. Capital Area IU is providing ongoing TA. We have cross-evaluation of outcomes will be conducted at regular intervals. And an end of year 1 survey has gone out, and we will be collecting that data through the end of January from them and using that to inform what our 3rd year will look like. And ISRA is assisting with that. And then our last slide is our PDG communication plan. I'm just giving you this as a reminder. I've had shared this in the past. The PA Key website is the main driver of all communication as it comes out of PDG. And thank you very much. If there's any questions, please don't hesitate to reach out or contact me. Thank you.
Thank you, Lisa. Marnie, I believe you are next.
Thanks, Netta. Hi, everybody. Good to see you. I just have one update. I know there's been some questions about career pathway approvals, and we have some information from the registry verification team. As of June, just to give you some history, in June, we were looking at approvals that were taking up to about 6 months, actually, because there was just a huge increase in need and asks for career pathway placement, but also we had different enhancements going into the system that were going to impact approval time. Typically, our practice is 90 days. That's what we have always sort of lived by. In June, that was, as I said, quite a bit longer than that. But we added a new verifier in June. Then we added another verifier in August, a bilingual verifier. And we implemented an auto renew functionality in July that actually, when there's no changes or updates needed in the career pathway, it automatically renews folks. So I'm happy to say, as of this month, November, we're back to our 90-day approval process. And we expect to be able to stick with that moving forward, barring any other changes to policies or practices. So I'm happy to answer questions if anybody has them, but I think this is good news, and we're really excited about also being able to add a bilingual verifier to our team to help diversify the complement there and really address the needs of all of our workforce. Thanks, Netta. That's it for me.
Yeah.
Okay, Martin, thank you.
Well,
Okay, next up, Brandy Fox.
Hi, good afternoon, everyone. You can go to the next slide. I just have a couple updates for you from an infant mental health lens. We did submit with OCDEL's participation and support an application to 0 to 3 for a infant early childhood mental health financing policy technical assistance project. It is intensive, policy-focused technical assistance around identifying strengths and gaps in your system relative to the mental health needs of infants, young children and their families, as well as policy or financing policy around kind of that continuum of promotion, prevention, and intervention. So I wanted to let you know that we submitted an application. I have the proposed core team here listed. You'll notice that Erin Traup is on there. She is a SAC member, so it was a really great that she kind of fulfills that required clinician representative, but also is deeply connected to the SAC. And we also listed several stakeholders or advisory groups that we would contact and be in touch with over the course of that. I think it's a 6-month technical assistance project. So we should be hearing by the end of this month whether or not Pennsylvania will be one of the 10 states that are invited to attend that cohort. Next slide, please. Oh, a little bit about the proposed goals in that application was really coalescing around a cross-system shared understanding of what infant early childhood mental health is, really looking at our landscape, our strengths and our systems gaps, and financing opportunities, using that data to analyze kind of or influence different funding approaches or graded and leveraged funding to promote system enhancement, and then really thinking about how do we use this TA opportunity to really start to think about what higher levels of care do we need for our infants, young children who are really presenting with more severe mental health needs, and making sure that our systems partners are able to also support young children. Next slide. I wanted to give you a quick update on the infant mental health scholarships for early childhood education professionals. As of Friday, close of business, we actually had 331 applications from our workforce who are showing interest in wanting to participate in the infant mental health certificate with the University of Pittsburgh, the professional development certificate. So Louisa and I are meeting later on today to kind of go through 331 applications. But I just want to note that I think that this data set gives OCDEL some insight into OCDEL and all of us really, some insight into how many of our workforce are really wanting content and professional development around infant early childhood mental health topics. And I think that it's something that we can use to really start to be innovative and creative about how we might meet that need. I know Lisa kind of talked a little bit about rapid response, but I just wanted to include for this group as the project lead for rapid response, we are working on a statewide consumer satisfaction survey so that we can really kind of gather consumer feedback on the helpfulness of rapid response in order to support that cross-sector or cross-grantee evaluation and sustainability plan. We are working on consistent and public-facing messaging. And we really reiterated in October that, you know, rapid response team efforts really should be supporting OCDEL policies and priorities in the field around expulsion suspension, and encourage those grantees to triage those requests and make sure that they're reducing duplication. So for example, if a program already has mental health consultation involved, you know, rapid response probably shouldn't get involved because mental health consultation is a higher level of service. Next slide, please. And I did include in the slide deck just initial 6-month data snapshot for anyone who might be interested. You'll see that our rapid response grantees served about 252 requests. The majority of those little people were that 3 to 5 age range, which is not surprising. Next slide. You'll see that the average length of rapid response is about 44 days. And 174 referrals were made for additional supports as a result of rapid response. So you'll see that rapid response is in there. They're providing kind of a quick gap filling service, but they're also bridging community services for families and programs. Next slide. And just what I really loved about this slide is closing outcomes. You'll see that 68% of those rapid response cases were maintained in their early learning program. So that's a really nice, you'll see there's still some expulsions happening, but the majority of the kiddos were maintained in their early learning environment. Next slide. You probably will not be surprised by these challenges. You know, rapid response grantees are saying, you know, there's that workforce shortage and caregiver stress is a huge thing. Still kind of managing kind of the unrealistic timeframes kind of set by childcare programs who are stressed out and really worried about kiddos to get higher levels of care. We know the behavioral health service sector also has a workforce shortage and also has different medical necessity criteria that are needed to approve services. You know, long wait lists in behavioral health. That's something my team, the mental health consultants, are also reiterating. A lot of needs still for how are we reaching all of our workforce and parents and caregivers about social emotional development and responding to behaviors that they perceive as challenging, and still a lot of need to share resources around expulsion suspension practices and all the practice guidelines and policies. So think that was my last slide. I would just say, if you want to add to the chat anything you're hearing specifically about rapid response teams, I will take that down and go back to the PDG team and circle back to Netta with any answers to any questions you may have as well. Thank you.
Thank you, Brandy, and all of the PAK team. Next up on the agenda, I just wanted to review the subcommittee structure. More information, including the EO associated with the State Advisory Council, can be found on the State Advisory Council webpage with the link on this slide. But I got a little bit of feedback, just with maybe a little bit of confusion about the State Advisory Council and its relation to the subcommittees. So I just wanted to run through a couple quick facts. The State Advisory Council is governor-appointed members of 25 members, and we refer to them as SAC Exec. Each SAC member is assigned to one of the 5 subcommittees, and each subcommittee is co-chaired by a SAC Exec member and an OCDEL staff member. Each subcommittee has an additional 20 to 25 members, and they are not SAC Exec members. Here are the listed 5 subcommittees, of which each SAC Exec member is assigned. And I just wanted to note that through December, I'll be pulling all attendance reports and reaching out to subcommittee members who haven't been as engaged, and with the intention to increase their participation or to figure out where the vacancies may lie within the subcommittees. We'll then begin to use the process of filling vacancies that the DEIB subcommittee is currently providing feedback on, and Carol Austin will speak more to that when it's her turn to provide an update on DEIB subcommittee. So I attend each of the subcommittee meetings and provide an update to each subcommittee on the work of the other subcommittees. And since this is the last quarterly SAC meeting of the year, I asked the co-chairs of the subcommittees to give an in-depth review of what's happening in each subcommittee today. So first up, we have Adrienne Briggs and access to programs. Hi,
Good
Adrienne.
afternoon. Hi, good afternoon. Okay, so Netta, you move the screen. Okay. So we're going to go to the subcommittee members. So if you can take a couple seconds just to look at the screen and see who our subcommittee members are, that would be great rather than me reading each one to you. Okay. And what we have been doing, which one you on, Netta? Okay. What we have been doing is we established our mission statement. We identified AP potential work. Also, we reviewed portions of the ISRA, the needs assessment used to guide the startup grants. We did that back in August. In September, we did a discovery section to gather feedback to Compass, which is findchildcare.pa.gov system. That was very interesting. Okay, and in November, we're looking at the next steps to review common themes, sessions, and discuss solutions. Netta, did you have anything you wanted to add?
No, that covers it, Adrienne. Thank you.
Thank you.
Next up, professional development co-chairs Robin Howe and Barry Wiesling. And Robin is going to provide that update.
You had it on the mission statement first. Did you want to go through that or not?
I think we can show it and move along.
Okay, all right. So it's just you can read it yourself if you want, just talking about informed decision making for professional development. And then that next slide has all of the people who are on all the members of the subcommittee. When you're ready to go, there we go. In January, we talked about member-led discussion on priorities. We had breakout meetings, and some of the big things were PQAs and whether to renew or not, workforce, CDA incentives for people so that we could get more of our workers to go for the CDA, and then PD funding. And then the first was to focus on PQAs. In March, we voted on our mission statement that we just showed. And And then we had a whiteboard to gather feedback around the Pequot's issues. In May, though, we had someone from the Pequot's team go over a lot of the new things that are happening, or the things that they needed to hear what our subcommittee had to say. And they were looking for, and the subcommittee was looking for solutions. Let's see. And then in September, Netta introduced our new Bureau director, and then there were updates on funding initiatives. What is what with Teach, PDOs, Rising Stars, and CDA vouchers. These are the updates. Then there was a layout of the application webpage, added more quick links, additional resources were put in there for people to see, and they were separated between new applicants and renewal applicants, which is kind of nice. They updated the organizational Pequot's applications, the overview module template, and the overview module reviewer were rubric. And then what we're working on now is the updates to the policy procedures manual, other updates in the overview of module reviewer rubric, and state recommendation to address confusion and burden statewide. Okay, moving forward, we're going to meet every other month, third Tuesday at 12:30. We're breaking into small groups. We're doing ongoing improvements for professional development. We're talking about the Pequot's improvement statewide, and a provider resource page contribution.
Thank you so much, Robin. Next up is Physical, Behavioral, and Mental Health Subcommittee, co-chairs Brittany Massari and Stacy Kenny. And I believe Stacy is going to be providing the updates today.
Yes, I am. Thanks, Netta. Hi, everyone. I'm Stacy Kenny. I just wanted to give a quick overview of what our subcommittee has been doing this year. Just take a few minutes. We have a lot of subcommittee members. They're all very active and involved. So just wanted to take a minute to recognize them and thank them for all their input and hard work. But if you get a chance, these are our subcommittee members. Also, we developed a mission statement this year. I won't read this, it is a little lengthy, and we posted it at a previous SAC meeting, but this is our mission statement around promoting awareness of physical behavior and mental health. Also this year, we started with a lot of ideas, just physical behavior, mental health, are all the health. So there were a lot of ideas and a lot of thoughts around what we wanted to work on. So Brittany and I decided to kind of start slow, do some presentations that might be of interest to everyone in the group, and then gather feedback about where we want to go with our subcommittee. So these are some presentations that we did this year, and I want to thank the presenters. So we did IEC MH consultation from Lindsay, Creative Childcare Solutions from Karen, AIM from Aaron, and every meeting we have ECC updates from Sadia Batul, because ECCS is a ad hoc subcommittee of our subcommittee. Next slide, please. Okay, so when it came time for us to break everything down into what we wanted to do, we had a lot of ideas, and we had to kind of make those more actionable and manageable. So Netta helped us. We did a whiteboard activity as well, with different ideas that people put forth and things that they saw as issues in the field that they wanted to tackle. And then we took all that information, it was a lot, and we came up with some themes. So our themes were fragmented services and coordination issues, communication and messaging issues, financial and access challenges, and provider training and issues. Next slide, please. Then we decided to make that even more manageable and actionable. We were just going to take one of those themes where we might be able to get a couple of quick wins and quick results. So we picked the provider training issues theme, and then we had to narrow that down even further. There were 4 things within that group that we asked our subcommittee members. We sent them a survey monkey. We asked them to do some prioritization around just under the provider training issues theme. What is your priority? So Netta, could you go back to there? So these are the 4, no, back to the priorities. Next one. Sorry. So these are the 4 things that were a priority for our subcommittee to start looking in. So the last meeting we had, the majority of the meeting was to start to dig into these 4 areas. And we're going to continue that with our work groups during future meetings. I think that's everything.
Yes, Stacy, thank you so much.
Thank you.
Our next subcommittee is Childcare Certification and Quality Rating. The co-chairs for CCQR are Emily Vonder and Tamila Ferguson, and I believe Emily is providing the update today.
Hi, everybody. Good afternoon. Our mission statement, as you can see, is posted on this slide. In our discussions, we talked about it continuing to evolve. These are the subcommittee members of our committee. I feel like with our group, the biggest emphasis that was made was between sort of the division and the difficulties with providers and certification reps, and we've seen some great improvements in that area by facilitating some ways of communicating some of those complaints through an email that we created through the RA, some improvements with access to the HS forms and so forth. And our continued priorities will remain to try to close that gap between the providers and their certification reps. Some of the efforts that have evolved, there will be a podcast that will be up and coming pretty soon, and Ruby will be able to talk a little bit more about that. As a result of some of our efforts, there has been a new subcommittee, you can say, that has evolved as a STAR survey that was completed back in early October. And some of the data that we gained from that has allowed us to have more talking points that I think will really tie in well with some of the focuses through the CCQR committee that we have. So we have a meeting that will be coming up on December 6th, where we'll be collaborating what we've learned through that survey so far, along with some of the continued focus that we have with the CCQR committee. So thank you, Netta. Thank you, everybody.
Thank you, Emily. Our final subcommittee update is diversity, inclusion, equity, and belonging. The co-chairs for DEIB are Carol Austin and Corey Weitzel. And Carol, I will pass it over to you.
Great, thank you, Netta. You can move right along to the next slide. Okay, good. So here you can see our subcommittee members. I'll give you a moment, as everyone else did as well. Great, and so, you know, right at the beginning of formulating, we, of course, like everyone else, developed our own mission statement, which you can see here is to produce concrete, tangible policy and process recommendations and steps that can be taken to reach the policy changes, to eliminate disparities for marginalized groups, namely children, families, and the EC workforce, and using a body of evidence-based knowledge informed by experts around best practices regarding DEIB. We had established some norms as well for our group. You can move on. So in terms of where we've been focused, you know, after we did the mission statement, and we really looked kind of broadly with, but specifically pertaining to those who were on the committee, to their areas of interest with regard to diversity, equity, inclusion, and belonging, which can be very broad. And we did develop a number of interest areas. But the first one we started to focus on was really being able to make some kind of a determination around really what's out there, what's available. And so here in this first, the first set of work here, collecting perceptions and data on diversity, equity, inclusion, and belonging in ECE. And we've started to work on putting together 2 surveys so that we can actually, rather than assuming, we can broadly reach out across the state to providers and to families to really be able to determine what their needs are and also what they currently find is most helpful. Okay, both in terms of professional development or training and resources. So we've completed a provider-facing survey, and that survey has a number of things in it, including we have the demographics. We're finding out what role they play in the program, what kind of program they're in, what kind of location they're in, whether it be urban, rural, etc., what kind of educational level they are, what's the star level of their program. So we've collected a number of demographics up front, and then we've all in this survey also tried to find out what their interest level is, what their knowledge level is, and then what resources they found useful and what resources they need as well. And that survey, the provider-facing survey, is complete, but we made a decision to hold on sending that out until the family-facing survey was complete. And so currently we're in the process of completing the family-facing survey, which should be complete at our December meeting, with the goal being to send both surveys out at the beginning of the year to providers and to families as well, so that we can best ascertain from them what they see the gaps are. Simultaneously, along with that, we've been taking a look at the PD registry, because we said, okay, great, we're going to get this input. And we also want to know what really is out there. And it'll be interesting to also see if folks are aware of what is out there and how helpful they find that. So we've been engaged in an analysis, really looking at what is available in the registry in terms of the timing for trainings, the cost of trainings, the participation, and whether or not they fit within that STAR standard. Okay, and so we're in the process of doing that. The results of that analysis are also going to be shared at our December meeting. So we'll have the family-facing survey and the results of that finalized. Okay, so that's a body of work there. And then the second is this body of work we call cohesion between DCE field and OCDEL. And one of the things I know that there has been OCDEL and staff have been engaged in doing some DIB work. And we want to ensure that there's some cohesion. We want to hear some more and look some more about that work that's being done and see what we can learn and utilize from that work as well. Okay, and then the second piece of this is in terms of, Vanetta alluded to this earlier, we have any number of people who've been asking to serve on subcommittees. We know that the SAC members are appointed by the governor, so there isn't an option there for whenever our term expires, but there's the option for people to participate in subcommittees. What we want to do is ensure that we have an equitable way for people to come in. And we want to make sure that that we really are capturing people and views from across the state. So the subcommittee is now engaged in really looking at what should be the parameters and the criteria around that. So we began that work a couple of meetings ago, and that's in process. Hopefully, maybe by January, we would have some kind of a draft to be able to bring to this committee. So that is at the next SAC meeting, we should be bringing to you both surveys, and we should have some kind of a draft here also to bring to you with regard to the criteria for participation. Okay, that's it for our update.
Wonderful, Carol. Thank you so much. If there are questions for subcommittees, you can add those to the chat, or you can always email either of the co-chairs. Next up is OCDEL updates from Deputy Secretary Brown.
Good afternoon, everyone. I promise to be brief. I see we have a very full agenda, Ms. Netta, so. So just wanted to ask everyone to please save the date for our 2025 OCDEL conference. It'll take place April 22nd and 23rd. We are going to the other side of the state this time, so we'll be at the Wyndham Grand Pittsburgh downtown. So really looking forward to it. This event is actually going to focus on deepening our understanding of child and adult well-being, and it'll bring together some program experts, practitioners, and educators committed to creating stable and secure environments for young children, their families, and the adults who serve them. So additional information will be coming soon. Really excited to announce that our certification regulations are now available in Spanish. A special announcement was actually sent out to the provider community this morning with direct links to our Spanish regulations. So really excited about that. The 2024 ECE Equity Champion Awards application will be released either this week or next week. And really looking forward to this event that will honor attendees at the PA State Capitol. And our CQI Awards, the deadline for the applicants is December 13th. The funds must be spent by February 2025. And so far, nearly $9 million have been awarded to providers. And finally, we have our OCDEL program videos. So OCDEL partnered with JBL Marketing to create family-friendly informational videos. These program videos focus on certification, child care subsidy, early intervention, our family support programs, Keystone Stars, and pre-K counts. This information was released in the October Early Ed News, and we will now watch the CCW video to give you an idea of what these videos look like.
Just someone stop me if the volume isn't working.
The volume isn't working.
Okay, give me 1 second.
Netta, what you'll have to do is unshare. And when you reshare, you're just going to have to click the button that says share computer sound.
Yes. We will loop back. I'm going to go to Nia Harris, Director, Bureau of Early Learning Resource Center and Operations.
Good afternoon, everyone. I have two quick updates for you this afternoon. The first one is a very happy update for me. I believe last time I met with the SEC committee, we discussed an issue with providers receiving payment from our forward grantee in Region 18. I am happy to announce that after a lot of hard work and effort, that we have found a solution to this issue and it has been rectified. Our current grantee, PHMC, has issued payments to the remaining providers who were not paid by our former grantee, and to date, they have paid a total of 226 providers who are still awaiting their payments from June. So I'm really happy that we were able to work out a solution and get some release for these providers who were patiently waiting for the funds that they were entitled to. The work is still ongoing. We are still working with providers who may not have received payments, but now we have a vehicle for rectifying those payments for those Region 18 providers. My second update was to give you an overview of our ELRC directors meeting. Typically, and I don't think a lot of people attend those meetings on this call, but typically OCDEL is giving a lot of information to our ELRCs about our new updates with policies and procedures and things that we need them to do. But we decided to take a different direction this particular meeting. Our ELRCs expressed the need to get in contact with OCDEL and just bring us into their world and have us have a bit of a listening session so we can figure out some of the nuances that may have been missing from a program office level. One of the things I'm very committed to in this current role as the ELRC Operations Director is breaking down that ivory tower that often exists between administrative bodies and the people who actually do this work. So although some of the things in the listening session and that director's meeting may have been hard to hear, or, no one ever wants to hear that they may not be doing the best job, but it's a very productive session. And we came up with some actionable solutions to moving forward. So one of those solutions was increasing communication with the ELRCs and OCDEL, and also getting their feedback when we have upcoming operational efforts and policies. So it was, again, really productive. It was a really eye-opening session for both OCDELs and the ELRCs, and I think this sets forward a path forward for us to work in a more compatible way. So those were my updates, Netta.
Thank you, Nia.
Thank you.
Gonna give it one more go.
Pennsylvania's Child Care Works program may help you afford the quality care you want for your child. Child Care Works is a program funded by our state and federal government that helps income-eligible families pay for reliable childcare and early education. If you meet the income guidelines, your local Early Learning Resource Center, or ELRC, will pay part of your childcare cost. This is called a subsidy. You will pay part of the cost too. This is called your family copay. All payments are determined based on income and go directly to the child care provider of your choice, as long as they are certified through the state. This allows you to choose the type of care and provider best suited for your child. Child Care Works is open to infants, toddlers, and school-aged children. But to qualify, families must meet certain income, employment, and education requirements. To learn more about eligibility requirements and to apply, visit www.findchildcare.pa.gov. In Pennsylvania, all childcare.
Okay, sorry for the technical difficulties. Colin did put the link into the chat, and that's where you can find all 6 of the program videos in both English and Spanish. Luisa, Director of the Bureau of Early Learning Policy and Professional Development.
Netta. Good afternoon, everybody. Happy to be here with you today. You can move on to the next slide, Netta. Sorry. You're almost going to drink your water. Just a review of the current Bureau priorities that I've identified since my tenure here, starting in June. Our state plan submission and implementation of the state plan, so really thinking through how to be intentional about what we write within the state plan, support for our pre-K counts and HISAP providers, workforce development, understanding, that there are some challenges that our ECE workforce is facing, and there's opportunities for us to improve the support we provide to the provider community, and then thinking about quality, especially as it relates to Keystone Stars. And so I'm just going to overview a few updates on these specific priorities. For our state plan, we officially received word from the Office of Child Care that it was approved on November 8th. And so we'll have to submit an appendix by January 7th, which includes the areas of the waiver and the areas of noncompliance found through the state plan. We did attend a webinar on the 14th that overviewed some of the pieces of the appendices because they are a bit different than last year, and also identified some thorough lines between state plans that were not approved and noncompliance across different states. And so we now have a better understanding of the response that we need to provide and the details to OCC. In addition to that, our team will be working, sorry, Netta, on our quality progress report, and that is due on January 31st. Just a reminder about what we included in our waiver for the CCDF final rule and some updates on those. So there are some policies that do not need to change, but there are some systems that need to change, and those are the easier lifts, if you will. So the consumer education reports listing compliances and non-compliances is in process. We do anticipate that that's something that can happen sooner rather than later, likely sometime within the 2025. And then prohibiting family co-payments above 7% of family income. Again, that's a systems change. Currently, our system minimum is $5, and we just need to make a shift within our system to allow it to go down to $0. So those are 2 of the easier lifts. For grants and contracts for children with disabilities, children in underserved geographic areas, and infants and toddlers, This is also something that is in process. We do have infant toddler contracted slots. We offer pre-K counts, which does meet children in underserved geographic areas. And we're working through some of the other grants and contracts for children with disabilities. The big lift, if you will, is paying providers prospectively and using enrollment-based payments. And these two concepts sort of work hand in hand, require both policy and procedure updates as well as system updates. So we have a strategic plan meeting to discuss this with our Deloitte consultants, and we'll be pulling a cross-bureau team to discuss this. This is absolutely something that's great for the field and we support it, but we will need time to make those updates on the IT side. An update for our pre-K counts and HISAB programs. We are planning a grantee conference or gathering for 2025. That should say 2025. So that's my fault. I'm sorry. Based on feedback that we received from a survey from both pre-K counts and HISAB, it's something that they are asking for, that they would like additional training and support to run their program most effectively. So we will be planning those. We did increase cost per child per the 24-25 budget. And we're also offering additional professional development and office hours. These are a voluntary call that folks can hop on. We provide topics that are pertinent to the grantees that we're seeing trends of on our end, and they can also submit additional topics for us to discuss. Something I'm really excited about is we're going to be working with the Community Action Association of Pennsylvania to offer a special training related to both PA Navigate and community action associations across the Commonwealth. We heard from lots of providers on the pre-K side that families need additional support and resources, and those providers don't often have the opportunity to do those. So we want to make really great connections between our community action agencies and our grantees. The other piece of that is the PA Navigate project, which providers will be able to claim their listing and allow families to find them sooner because they are providing a service to families that are in low-income communities. So both of those things are slated to occur early in 2025, and I'm very excited to be able to provide that to the grantee community. Our workforce programs, we did host a summit session during the PACA conference in October. Heard lots of really great feedback from providers, from ELRCs, and so we're listening, we're continuing to listen. And then we also identified some possible opportunities for us to improve marketing around PDO Rising Stars and Teach to sort of help people navigate through the alphabet salad, as I call it. And so some of those will be really quick wins for us, but we are looking at how can we continue to improve this in the future and be really strategic. And then Penn State ISRA team is also conducting a workforce study, which will help inform some of the work that we do moving forward. Related to Keystone Stars and quality, we are looking at the new NACCE accreditation process because there are some drastic changes within NACCE. And so we're determining what does that mean for our alternate pathways for Keystone Stars. So some members of our BPPD team are looking into that, and we'll engage in conversations with some of you and additional providers to really understand what the timeline would look like on that and how it would impact our Keystone Stars program. There are a few minor updates to the Keystone Stars procedures and policies, nothing major, because again, we're thinking about fundamentally, what does quality mean in Pennsylvania, and does our program reflect that, and does it reflect that in an equitable way? So we don't want to make too many changes along the way, since we're planning for sort of a bigger change. Additional conversations with the subcommittee of SAC, which was very helpful. So thank you to those subcommittee members for inviting me to their meeting last week. And they're going to continue having those conversations this week with a member of our team. And then I'm very happy to announce that our Bureau will have a new quality division. So currently our Bureau has quality and policy sort of linked together. And so this new division will allow quality to be separate and that team to really focus on quality. Keystone Stars, what does that mean? And so I'll have 3 division chiefs under me, and we'll be hiring for a quality division chief. So very excited about that because that's going to put a lot of emphasis on this work. I'm going to review, Lisa alluded to this earlier in her presentation. I'm going to overview the startup and expansion grants. There are a lot of slides, and I know this meeting is packed, so I'm going to try to move through them fairly quickly. So we did receive money, as Lisa discussed, through PDG funds to provide expansion or startup grants. So the idea of the grant is to increase childcare opportunities in underserved communities. So our team at ISRA presented some preliminary data on child needs assessment and identified ELRCs to meet this grant. If you can move on to the next slide, thanks. So again, the intent is to expand childcare in geographically underserved areas of the state. So this can happen many ways. A smaller provider type would want to convert into a larger provider type. An existing provider wants to add additional classrooms. Someone wants to reopen a classroom that was closed previously. Someone wants to create a new childcare program. And then the other piece is if current Head Starts or current private licensed nursery schools want to extend the services that they provide, they would become a certified provider under DHS, and then they could provide extended care in the before and after program, or they could provide summer care, or both. So there again are different types of grants. Netta, sorry, can you move on? Thank you. A conversion grant, which would be the Head Start agencies or private nursery schools that want to convert into a DHS center, or a family care home or group home wants to move into a center. An expansion grant would be expanding the amount of children served within a location, adding additional license capacity, reopening a classroom, adding additional service hours. And type 3 would be a startup grant, which is starting a new program. The regions of service that are identified are listed there for you. It's ELRCs 1, 2, 3, 6, 8, 9, and 10. Yep, thank you. To be eligible for the grant, these are the eligibility requirements. I won't review them in super detail, but essentially they need to have a regular certificate of compliance, not be in a suspended status, not have any current liens against them, or they have to be a current federal Head Start grantee or a private licensed nursery school. The next few slides cover some of the eligible expenses within the grant. So you can see there, if you're opening a new classroom, if you're expanding a program, there are obviously needs that you'll have. So indoor safety equipment, outdoor safety equipment, minor renovations to allow for a space to serve more children, but no major construction or major structural changes would be allowed within the context of the grant. And then the next slide covers some of the materials and equipment that you would need to support a classroom, and some personnel costs related to recruitment for additional services. Next is just a quick update about the CCW rate increase. We are, as you all know, moving to the 75th percentile. Our policy announcement is in draft, and we prefer to get that out as soon as possible. So I will pass it to Ruby. I think that's what I'm supposed to do.
Yes, thank you, Louisa. And there is a question in the chat for you. Thank you.
Thank you.
Hi, everybody. You can progress the slide. Netta, thank you so much. All right, so the certification rewrite project, we are in the final review. We only have one batch to go. You cannot imagine how excited we are because we've been spending about, I would say, 4 to 6 hours per week for the last year that I've been here reviewing these, and the committee that's working on it has been doing it a lot longer. So we're excited to be reviewing our final batch, and then the exec will review December and January. And then, of course, our legal review and public comment period will happen. Then revisions, December 2026 is release date. And of course, providers will have 1 year to become compliant and 3 years from staff qualification changes. The update, sorry, Netta, the link to the timeline. Can we put that in the chat so people know where to find it? That way you can kind of follow along. We do update it pretty regularly, not like in live moments, but as regularly as we can.
Colin will add to the chat.
Thank you. All right, you can progress now, sorry. All right, so we have a couple things coming that are exciting. First being a training facility. The PA Key has given up their 3rd floor to us to have some mock classrooms so that we can better prepare our certification team for the field by setting up really challenging scenarios during their first 6 months of employment during their training period. So this will be for new and existing certification team members too, so that we can do periodic trainings as well. Other bureaus will also be using this space. I'm excited about this. The construction is complete, and we're just looking now at getting the materials and equipment and supplies for the training classrooms. We are also working closely with New York and Georgia to kind of look at their spaces that are very similar to what we want to do and getting some ideas from them as well. So our podcast that we've been hearing about now for a couple months is in our first episode is in final production and will be out hopefully by the end of this week or next week. The podcast will be called The Confluence of Partnerships with OCDEL Bureau of Certification. And if you don't know what confluence means, it means when three rivers come or several rivers come together. But it also means conversations and ideas and a merging of perspectives. So we really like the confluence word in our title, and we'll be introducing the federal monitoring process in our very first episode. And we want this to be about the why. We want providers to listen to the podcast with the understanding that this is why certification does some of the things they do. And of course, me being a lifelong provider will be there to kind of put some perspective about the provider's view in there as well, so that we can have that joint partnership. And thank you. So there have been some civil rights compliance changes. So you might have seen that announcement come through from the Bureau of Equal Opportunities. The cover page has changed. I don't need to go into extreme detail. You've probably read the announcement. There's some change in the non-discrimination policies and the wording around the ADA compliance and accommodations. There's an advertising requirement in there, new legal requirements, and they were effective on October 1st, 2024. So that's a little bit of a change that people are going to have to get used to as they come up with their renewals or apply for new programs. And CELS, our consolidated eligibility letter system. We were hoping to have an announcement out. We have identified a couple things that are happening, a little bit of bugs, if you will, and the system testing is ongoing. We're hoping to have the announcement for the CELS out to providers along with the training on how to do it by December 1st, assuming everything gets fixed. And then there's the CPSL changes also. I don't know if you all recall back when COVID happened, we kind of stepped a little bit away from the CPSL requirements and allowed providers to just have a few of their background checks instead of all of them. Well, we have to go back to all background checks prior to or during provisional hire so that we can make sure we're in compliance with the CPSL. So you'll be getting that announcement by January 1st. There will not be any citations at all until after January 1st, 2025 around CELS or the CPSL change. And of course, our relationship building, partnership building, however you want to state it, is a priority for us in certification. We definitely want to become, we know we're monitoring and we know we're regulators, but we have this desire to become more provider-centric in the work that we're doing. So the quality assurance team in our operations department is really busy doing sporadic visits with CERT reps right now, just to kind of get some feel for some of the trends in the field so that we can better provide resources and tools to providers while our CERT team is out there. We want to identify inconsistencies across the state so that we can fix them and make sure that we're having one consistent message no matter what region you're in. We also, I didn't put this as a bullet, but we also were at Summit and we tabled for the first time and we had an opportunity to really connect with providers while we were there, give out some, free little soaps for the first aid kits and a lot of resources and postings for your walls. That was an interesting opportunity. We did it at the OCDEL conference last spring too, and it was really fun to connect with providers that way. You'll see more of that. And of course, training for certification staff. We are going to increase the customer service training that we provide in our first 6 months of employment when a certification staff start. However, we also want to bring everybody back to be trained on exemplary customer service. And what does that look like? We also want to, again, provide support and resources for those technical assistant opportunities. And having cross-regional meetings with our certification team so that they can better understand each other, I think will be very helpful. All right. So ELS is still coming. The rollout is not happening right now, but it will over the next 2 years. You'll get plenty of notice and lots of communication about that when it happens. Multi-agency licensing and management system. It'll be in addition to the certification. It will assist with complaints and extensive reporting capabilities. It'll be a huge help to our certification team when they're in the field and when they're entering LIS information into the system. So the ELS listserv for comprehensive information is linked here as well.
I'm going to move forward 2 slides. I think there's an error on the next one.
Oh, okay.
That's my fault.
No problem.
You're done, Ruby. Thank you so
Okay.
much.
Thanks so much, everybody. If you have any questions, let me know.
Okay, I believe Stacy will provide the update for the Bureau of Early Intervention Services and Family Supports.
Thanks, Netta. Yes, hi again, everyone. So I'm providing updates on behalf of Lisa Parker, who is our director, who is off today. Just one big update to share. We had our Early Intervention Leadership Conference in October at the Penn Stater, and it was a very successful conference. We had over 203 participants, including 136 infant toddler leaders, infant toddler and preschool leaders, and 9 family leaders. And the rest, if you do the math, that doesn't add up to 203, but the rest were OCDEL and EDA staff. So out of those participants, on the evaluations, 95% of people rated the leadership conference as excellent or very good. So we're happy when we see that. And then some of the major themes that we got out of the evaluations from the conference, we asked programs when they complete the evaluation to identify 2 new ideas they gained from the leadership conference. And some of the themes that we got out of that was they wanted to implement some things around inclusion and belonging. So going beyond just having children with disabilities be included, but creating a sense of belonging. Sometimes in early intervention, we have a tendency to say, sometimes our kids are kids, but they're not our kids, they're everyone's kids. They belong in their communities. And so we want to make them feel like they're part of that community. Some other themes that came out of the evaluations, our programs want to do more with assistive technology. So they mentioned that they wanted to learn more about the use of assistive technology and how it can be integrated into their programs for children with disabilities. There was a pretty strong focus on collaboration and communication within our evaluation. Programs wanted to learn more about and do more with trauma-informed care, leadership and change management, professional development and training, and family engagement. So also within the conference, there was a focus on state and federal inclusive practices. We had some really excellent speakers. We had 2 keynotes, one on the first day and one on the last day, and they were both excellent speakers that brought perspectives on the federal level around inclusive practices, but then also the speaker on the last day brought it from a personal level, and she was just fantastic. We also brought in family perspectives around inclusion, and we thank our family leaders who were able to attend and participate. We really value our family leaders and appreciate their participation, especially when it means being away from their own kiddos for a couple of days. But thank you to them for bringing that to our conference, it adds a lot of value. And I think that's all I have, Netta.
Awesome, Stacy. Thank you so much. If anyone has any questions for any of the OCDEL Bureau directors, you can add them to the chat, come off mute, or always send an email. So that's a good segue for our open time for public participation. As we know, this is a public meeting and all can attend. So we had someone reach out. Lauren Steperitz was recommended through EITA to hop on today and listen to the State Advisory Council meeting. And she just wanted to briefly say hello. So Lauren, if you could.
Yeah, hello. My name's Lauren Stuperitz. Thank you for giving me a little introduction and be able to join you all. It's interesting to learn, what goes on at the State Advisory Committee or Council. I live in Pittsburgh in Western Pennsylvania. I'm currently doing the C2P2 for early intervention. So I'm learning a lot about all the different parts of the structure of how early intervention and early childhood works in the state. And I just got back from a weekend of that. So I've got like all these ideas buzzing in my head. So it's a very positive experience for me to be participating in that. And I have a child in early intervention now in Pittsburgh public schools. That's our school district where we live. And a younger son who's in an early Head Start program here in Pittsburgh that's also run through the Pittsburgh Public Schools. I've been with early intervention since like the days of when the pandemic shutdown was sort of fading and you could start having very limited people would go out and do home visits, whether it was a home visiting nurse or our speech therapist that would come to our house. And so it feels like a long time ago, but it was really only 4 years ago for us. So there's been a lot that has changed. I'm really happy with all of the people, like the providers that we've met and all the folks who've helped me be able to help him get what he needs, my son who's 4.5. I just have a lot of gratitude because I'm learning about like all the different structures, policies, laws, funding, how that works and how it kind of breaks down and trickles down to the county and what they do and our school district and what they do. And so there's a lot that goes into it, but he's made some really excellent progress. We're really proud of him. He's still got, he's still a very unique person. And he does have a diagnosis with autism, so of level 2. So he's going to need like continuing supports, and I'll get ready to do the school age IEP and the transition, all those type of things. But anyway, I'm just really happy to meet everyone, and I'm really excited to continue learning more and to be able to just, see how things work and hear the important work you all are doing. So I think that's all I'll share for now. But if anybody has any questions or wants to reach out to me, you can feel free. I can leave you my email or something, but thank you.
Yeah, and I can connect you with Lauren if need be. Thank you so much, Lauren. Thanks for sharing your story and your lived experience. I really appreciate it. Okay, next up is State Advisory Council member updates. I have Diane Barber and Andrea Heberlein. Whoever would like to provide their update first.
I can go ahead.
I don't mind.
Oh, explain over it, Andrea. Go ahead. Yours.
Are you fine? Okay.
Yours was first.
All right. Okay. That's fine. Thank you very much for the time. Unfortunately, I don't have any slides to share, but I thought it would be great just to give everybody kind of a high level update on our innovation forum that was held on October 24th. This was really an important next step in our innovation project, specifically around engaging our state government leaders in a very new way, thinking about how childcare can be intentionally integrated into their own strategies to meet their own goals. And so we were really pleased. I mean, we had a very good turnout. The governor and the lieutenant governor asked their cabinet members to participate and to bring along their key staff. And so we ended up having like 11 different secretaries, 22 either deputy secretaries or executive deputy secretaries, 35 policy directors. And then we had about half of our commissioners, our business leaders, were able to come. This was in person. And then we had a smattering of philanthropic partners along with some other community leaders. So this was a really unique opportunity to speak to our state government leaders in a way that we really had never done before. And so we started off, Secretary Akbar Hossain, who is the Secretary of Policy and Planning for the governor, started off by really underscoring that, quality, accessible, affordable childcare is absolutely a priority of the government and of the administration, and encouraged all of the folks in the room to really think creatively about ways in which they can integrate childcare and, like I said, into their own priorities. And if you remember me sharing about our project over, the past, oh my gosh, since February, the goal of the project is really to drive new revenue into the early childhood system, kind of in addition to and beyond those public dollars that we traditionally ask for. And I'll talk a little bit about that as we move forward. But this is one way of looking at how does childcare affect labor and industries outcome, corrections outcomes, and integrating childcare in a way that is a win-win for childcare and the different departments. We also had an amazing speaker, Dr. Catherine Edwards. As a matter of fact, I'm going to put her, this is not the link that I just put into the chat and shared is not what she necessarily said at our forum, but it's very close to it. And I think for those of you who really appreciate the way a labor economist can underscore the importance of childcare to economic outcomes, she just does a fantastic job. And it was very clear that it resonated with the folks in the room. And then Deputy Secretary Brown was able to build on what the labor economist shared and really stress that Pennsylvania has a system that is set up to support quality, access, affordability, and professional development of the staff members. And then we had Lindsay Ramsey talk about, and she's many of you might know Lindsay, but she is a director of, the executive director of Shady Lane School out in Pittsburgh. And Lindsay did some really great storytelling that talked about what the reality of the system is really like for children, for their families, and really importantly for providers as well. And so I think really having those 4 components really set us up on a great path to think creatively about ways in which we can identify innovation to stabilize the provider supply, identify significant, I'm going to underline that a couple times, diversified and recurring revenue, the constant need to raise awareness, and also look at the ways that public-private partnerships can double down on enhancing and replicating and innovating around things that are already happening. We have so many great examples in Philadelphia and Center County and Pittsburgh and Erie that whether philanthropy has started or different grants through the ECE system, but struggle with sustainability. Where can we intentionally bring in the private sector to help offer levels of sustainability around that? So we really had, I would say, 3 strategies that we focused on. The one, like I said, integrating childcare across public, private, and philanthropic priorities, understanding, like for those of you who know, it is the foundation of almost everything that we hope to accomplish in the Commonwealth. How do we stabilize and scale up programs that work? And then how do we continue to increase awareness in a way that we can rally support? But what I really wanted to
peak ideas and kind of ideations around was this concept of funding, financing, and fundraising. There is an really important ask right now that's out by the advocacy community of $284 million for recruitment and retention. And I really wanted the folks in the room to know that this is really key for stabilizing the system, because everything else that we might do, like increasing capacity, or is kind of a moot point if you don't have the provider base, the quality provider base. And so, so we talked about that a little bit, but we also talked about ways in which we can actually do a better job of looking at public sector dollars through really creative ways, fees and fines, incentives for businesses and corporations coming into Pennsylvania, looking at opportunities to get, tax percentages from gambling and gaming, maybe new tax opportunities, which I know is like kind of a hush hush, but we really have to think about how can we support the, hundreds of millions of dollars that are needed to support the field, and redirecting a percentage of tax revenue. We also really thought a lot about private sector projects that can bring new dollars into the system through real estate, community development, of course, employee benefits, maximizing tax credits. We know that tax credits aren't the answer, but are there ways in which we can really double down on that to make a bigger impact? And looking at the intersection with corporate social responsibility goals. And then we even looked at like fundraising, knowing that it's not recurring, but how can we use some of the things that are being used by other organizations within government to raise money? Think about those check boxes on your registration fee. Imagine if we had those to contribute to an early learning fund. Again, is it going to solve the problem by itself? No, but it's a piece of it. Looking even for special fund license plates. Is there a way we could raise money for the system through creative ideas like that? And then certainly looking at the private sector to do some creative things around corporate fundraisers, and even like looking at things like a roundup, at the register. Well, imagine if it was a company that had, 700 sites within the state, and they decided to do a roundup at every one of those sites that would help, support the ECE sector. So we really were digging into creativity, getting people's wheels spinning, and really kind of understanding that public-private partnerships and legislation have to be a piece of this. We then had an opportunity to showcase some of the innovative projects that have been developed by our innovation team members around financing, funding, and fundraising, creative real estate solutions, employer-driven solutions, entry-level workforce solutions, home-based provider recruitment, and communications and awareness campaigns. And those creative projects, those pilot projects, are going to be kind of the baseline of how we gauge what our next steps are going to be. And I will say, we really tried to underscore at the end that Pennsylvania is absolutely well positioned. At the time, we all did not know exactly how the election was going to play out. But I think more than ever, the messages that I've given to, certainly the commissioners, but we also talked about at the forum, is that, Pennsylvania definitely has the system that is needed to advance quality, access, and affordability. We've got statewide, local, and regional systems, these examples that can be replicated, expanded. We have philanthropic champions on both sides of the state and in between, including community foundations that are really getting this. We have fantastic advocates that produce the research and the data that we need. And then we have ELIC with private sector champions that really can rise to the occasion and help us kind of counter anything that we might be encountering, at the federal level. And I will say, and I do want to kind of circle back to that, but I will tell you, we are now in the process of following up with the forum participants. They've all kind of indicated areas that they're interested in. The executive committee, my executive committee is weighing in with their guidance. And we are then going to be working with the I team to help prioritize our projects and initiatives. But the one thing that I will say, and I don't know if this is something that we can put on the agenda at another time for the SAT committee to really talk about, but I know with just being able to communicate with my commissioners, we're looking at, kind of Project 2025 and how what might be happening at the federal government is going to really influence what we need to be focusing on. And for those of you who have not had a chance to look at kind of what this, not saying that this is kind of the blueprint, but it is ideas that are circulating around. I just think it's really important that we're all aware that this very one-sided, but certainly robust document is calling for the ending of Head Start. It is, definitely any talk of universal daycare is what they called it, is gone. And, there is a focus on home-based childcare, but it's not necessarily in the same definition that we speak about home-based. It's definitely looking and inclusive of but families, like families and relatives, and which certainly can intersect, quite well with some of the home-based work that OCDEL supports and we know is so essential across the Commonwealth. But I think so for an example, one of the things that I would think would be really helpful for, the business leaders is to have some of those talking points around, Head Start and why Head Start is important. And so we're really going to be digging into those and would love to have, a conversation at this higher level on how we could be proactive in pushing things forward, just kind of in light of some, I'm not trying to be the naysayer, but just thinking how could we proactively anticipate some of the things that we might be encountering over the next 4 years. But that being said, feel very optimistic that, we are in Pennsylvania, and the governor and the lieutenant governor have definitely said over and over again, and it is the charge of the commission to make, childcare access and affordability and quality a top priority. So anyway, that's my update with a couple of postscripts.
Thank you, Andrea. Diane, if you want to hop in for the last couple minutes.
Thank you. I'll make it quick because I know we don't have that much time left in the meeting. I just want to say thank you to everybody who attended. We had about 700 direct staff working with programs with children and about 150 others, including our speakers and our exhibitors. I also want to say thank you to OCDEL staff. Shantae, terrific job. I'm sorry I wasn't there. I've heard absolutely positive things about the town hall and the other sessions that were done. I also want to thank Colin and the folks at the Key for helping us get Secretary Arkush to speak. I was on a call with her on Thursday, and I introduced myself and I thanked her for attending. She goes, there were a lot of people there. And we know that it took a lot. We did hear some really innovative things that people did. We had one program that rented an Airbnb and used Summit as part of a staff retreat, which was kind of cool. Our Hoover app had 131 different topics that people were connecting with. So I just wanted to say, I just wanted to say thank you. And the other thing that we deeply appreciated, we're going through the evaluation materials now. But I did ask in the opening session for people to let us know what was working, what was challenging, and what we needed to change. We had not been together since 2019. So it was trying to remember how we did that, right? So thank you. Thank you. And Netta. Okay, thank you. And Netta. Thank you, Colin. And Netta, of course. It was terrific. We are back again at the Penn Stater in 2025 from October 19th through the 21st. If you attended, if you have any suggestions for speakers or keynotes, please do let us know. We are looking at that information now. So that was quick. I hope that was quick. All right. Thank you, everybody.
Thank you, Diane.
Netta, do we have time for questions?
Yeah, we have a few minutes left.
Does anyone
go through the last slide.
from the group have some thoughts or comments or a question they would like to ask?
This is Lauren Stuperitz. Again, I'm just like observing and visiting as a guest to your meeting. So if it's okay if I ask a question?
Sure.
I was wondering, in light of what might be happening from higher up in our government systems, with the new administration, if there's anything, opportunities like locally or regionally or at the state level for a parent such as myself to like use my story, which I would say is like, these services of early childhood have changed our lives for the better. How I can use that to kind of advocate and try to get more security to these programs or funding or just more kind of public and professional support for it. Do you have any thoughts about that, if that's something that would fall under the purview here?
Lauren, if I can get your contact from Netta, I can connect you up with Trying Together that does advocacy work in the Pittsburgh region. And Emily Neff is on their advocacy team. I think that she would be the most helpful contact for you.
Yep, and that's a perfect connection with Emily Neff being a member of the State Advisory Council here as well. So I'll make that connection right after this meeting. Thank you, Lauren.
Thank you, Netta. So if there aren't any other questions, it looks like we can give people 3 minutes back of their day.
Thank you all so much, and let me know if there's any questions. Thank you, Leah.
Bye, everybody. Have a great day.